Hello, my name is Daniel Gundersen. My pronouns are he/him, and I'm going to be your nursing student today from Elmhurst University. And I'm going to help your nurse/doctor provide your care today on our telehealth call here. May I please have your name and date of birth?
Yeah, my name is Lauren Lehman and May 6, 2002.
Perfect. And what pronouns do you prefer being called by or addressed by?
She, her.
She, her. Okay, perfect. What brings you into the this telehealth call today? What can I help with?
I'm experiencing abdominal pain, nausea, vomiting, diarrhea, incontinence, and signs of a UTI.
Okay, wow, that's quite a bit of symptoms here today. That's definitely something we can take care of. Is any of this normal, or I guess what I'm trying to ask are any of these chronic or any of these usual health problems that you've had to deal with in the past, or
Um,
all relatively new?
Relatively new.
Relatively new. Okay, when we say all of these symptoms started occurring?
I would say probably close to a month ago.
A month ago? Okay, okay. So you are experiencing abdominal pain, nausea, vomiting, diarrhea, incontinence, and signs of a UTI, and all of this happened within about the past month? Correct.
Yes.
Okay. Well, then I'm gonna go through the old carts analysis with you. So you said the onset of these symptoms happened about a month ago, correct?
Yeah.
Okay. Is there any particular location that these symptoms begin, or they trouble you more than others, or is there anywhere that you might associate these troubles and symptoms you're having with in any particular location?
Not really. It's just my general stomach area. Um, it just hurts all over. Yeah.
Okay. Okay. What would you say the duration is? How long do these stomach pains last, or how long might you have any one of these symptoms, the abdominal pain, nausea, vomiting, diarrhea, incontinence?
Um, Usually a couple hours, I would say like 2 to 3 hours.
2 to 3 hours? Okay. Is there any overwhelming characteristics that you could describe these symptoms as? Is just a bunch of abdominal pain? Uh, is there anything out of the normal from the symptoms that you
Not really. It usually begins with like a sharp pain.
a sharp pain?
Hmm.
And that's the same for nausea, vomiting, diarrhea, incontinence, all of those symptoms.
Yeah.
That's with the sharp pain.
Hmm.
Okay, okay. Uh, are there any alleviating or aggravating symptoms that you associate with any of these symptoms?
The only alleviating one is usually trying to get some sleep.
Sleep?
Hmm.
Okay. Um, are there any treatments or any medicine or anything else other than sleep that you're trying at home to alleviate this pain or try to prevent it?
I'll take ibuprofen.
Ibuprofen? Okay. And the severity, what would you say out of 10 the severity of this pain is to you?
Probably a 4.
4? Okay.
Mhm.
Well, we're gonna go ahead and we're gonna get into your eating patterns here. How many number, what number of meals would you say you have a day?
2.
2? Okay. Um, do you have a specific eating pattern? Do you eat alone? Do you eat with friends, family,
I eat alone most of the time.
alone? Okay. Do you have any special diet, low sodium, weight loss, diabetic? Anything in particular that no?
Nope.
Any religious/ cultural effects on your diet?
Nope.
No. Food likes, what do you tend to gravitate towards? What do you include in a normal diet for yourself?
Salads, a lot of greens, fruits. I don't eat a lot of meat. Yeah.
Okay. Um, and what about your dislikes?
I don't really have any dislikes.
No dislikes? Okay. That's good. Room for improvement. Uh, Types of amounts of food eaten in the past 24 hours, including snacks and beverages. So what have you been kind of eating in the past 24 hours?
Um, I had a yogurt mid-morning and then taco salad for lunch. I'll usually have a granola bar um later in the day, and then for dinner I had salmon and broccoli.
Nice, nice. Do you take any nutritional medications, supplements, or herbal products?
No.
No. And your intake of fast foods. How many times a week would you say you go to get fast food?
Maybe once or twice.
1 to 2 times a week.
Yep.
Okay. Well, now I'm gonna get into your upper gastrointestinal symptoms, kind of related with your eating patterns and food habits. Do you have any food allergies or any reactions to any food?
Nope.
Um, any food intolerances or any reactions?
Nope.
Uh, Weight change, unplanned or planned?
Mm-mm.
No.
No.
Change in appetite?
No.
No. Problem chewing?
No.
Problem swallowing or choking on food or liquids?
Mm-mm. No.
Dieting, including herbal supplements and medications?
No.
Thirst, excessive or decreased?
Yes.
What is it? Excessive or decreased amount
Excess.
of thirst? Okay. Nausea, we already said that, yeah, you were experiencing some of that. Vomiting as well. You said you were experiencing that as well. Do you require assistance with eating?
No.
Do you have any problems obtaining or preparing physical or financial?
No.
No. Anemia?
No.
No. High cholesterol or triglycerides?
No.
No. And diabetes, gout, or a GI disorder?
No.
No. Okay. Okay. For this next question, I'm gonna get into bowel elimination patterns, and I'm gonna go ahead and show you a simple picture of kind of what typical stool might look like, and I want you to tell me what your stool might most resemble.
Um,
Um, it goes from number 1 all the way down to 7 here.
I
So
would say number one.
number 1, the dots.
Yes.
Okay. So you resemble separate hard lumps like nuts, and they're hard to pass.
Yeah.
Okay. Um, I'm gonna get into the lower gastrointestinal symptoms now. Uh, you said you were experiencing abdominal pain and tenderness, correct?
Hmm.
Is there a change in your bowel habits or how you're using the bathroom?
Nope.
No. You said you were experiencing diarrhea, correct?
Yep. Yep.
What about constipation?
Not usually, no.
Not, no. Okay.
Mm-mm.
Flatulence, gas, distension, or bloating?
Yes.
Yes. A lot of gas.
Mm-hmm.
Okay. Next page. Do you have any mucus in your stools?
No.
No. How about bleeding, bacteria stools, or tests for blood in stools?
No.
No. Involuntary stools, accidents?
No.
No. Use of laxatives, stool softeners, antacids, or antidiarrheals?
No.
Hemorrhoids?
No.
Hernias?
Nope.
A previous colon cancer screening, colonoscopy, or colon guard?
No.
Polyps or colon cancer?
No.
Prior abdominal surgery?
Mm-mm.
An ulcer?
Nope.
Gallbladder disease?
No.
Hepatitis?
No.
No. Um, I'm gonna get into your your urinary history voiding patterns. What are your usual voiding patterns, color, odor? How often do you use the rest? I guess go number two a day.
Probably once.
Once. And is there is it what kind of color is it looking like?
Mm, light.
Light?
Like light brown.
Oh, light brown. And is there an odor to it? Or anything out of the ordinary?
No.
No. Okay. Now I'm gonna get into your urinary symptoms. Do you have dysernia, burning pain when you're urinating?
Yes.
You do? Could you describe that for me?
It's just like a burning sensation.
A burning sensation. What is your frequency in using the restroom?
Um, I
Just
would say like every couple hours, every 2 hours.
okay. Do you have an urgency to use the restroom ever?
No.
No. Pulmonary, large volume. Do you have uh either a large amount of number two or number one?
No.
No. Flank pain?
Mm-mm.
No. You said you had been dealing with some incontinence, correct?
Yep.
Yeah. Uh, Hesitancy, difficulty starting urination?
Yeah.
Yes. Would you like to describe anything with that, or is it just, it's sometimes hard?
Yeah. It takes a second. Yeah.
Okay. Decreased force of stream?
No.
No. Nocturnia?
No.
Edema?
Nope.
Hematuria?
Nope.
You said you might have a urinary tract infection. I'm sure we could probably run some tests and try to understand and get to the bottom of that. So I'm gonna write down um, patient believes they may have one, and we can run some tests for that. Renal calculi,
No.
kidney stones, no.
Mm-mm.
Kidney or bladder surgery,
No.
no. Okay. Do you have any questions or concerns for me for today from today's telehealth meeting?
No, I think I'm good.
Is there anything else I can answer for you or you need from me in terms of today's call?
No.
Okay, sweet. Well, I'm going to head out of the room and leave the call soon, and either a nurse or a doctor will be in shortly to answer you and help you with all of your symptoms. Thank you for talking with me today.
Okay. Thank you.
Bye.
Bye.